Hi, welcome to 2-Minute Pharmacology, a series of short videos where I try and remove the mystery from medicines. Today we're going to be talking about tricyclic antidepressants. Tricyclic antidepressants include the medications amitriptyline, clomipramine, dosulipin, doxepin, imipramine, and nortriptyline. TCAs inhibit the reuptake of noradrenaline and serotonin into presynaptic terminals. They also block cholinergic, histaminergic, alpha-1 adrenergic, and serotonergic receptors. And this is part of why they have such a wide range of adverse effects, because they act on so many different neurotransmitters. They're indicated for major depression, but they're no longer first-line treatment. They were previously also prescribed commonly for neuropathic pain, but there are more effective agents now available, and they're also previously used for urinary incontinence. The precautions for prescribing: patients with prostatic hypertrophy have an increased risk of urinary retention with these agents. If patients have a lot of risk factors for acute angle closure glaucoma, they shouldn't be prescribed TCAs. If they have hypothyroidism or epilepsy, they shouldn't be prescribed, and cardiac effects of these medicines may worsen patients' cardiac conditions. The elderly are more susceptible to the side effects, the anticholinergic side effects, so we should be using lower doses and titrating slowly if we need to use these agents. In pregnancy, there's some evidence linking TCAs to premature delivery and congenital malformations, so there are probably better choices of agents. In breastfeeding, they have been shown to be safe for postpartum depression, although it's advised to avoid doxepin if possible, because there's been some links between neonatal respiratory depression and maternal doxepin use. Not to be used for children, and it should be avoided in patients at risk of suicide, as it can be fatal. Some of the agents are fatal in overdose. TCAs may prolong the QT interval, so they're contraindicated in congenital long QT syndrome, and also, as I said before, patients at risk of suicide should not be prescribed these agents. There's a large range of adverse effects for tricyclic antidepressants. Commonly, anticholinergic side effects such as dry mouth, dry eyes, constipation, and sedation occur. Also, orthostatic hypotension, sinus tachycardia, urinary retention, tremor, dizziness and confusion, weight gain, and loss of libido. There's another lot of side effects that are less common listed here, but too many for me to go into too much detail. There is evidence to suggest that doxepin and dosulipin are more toxic in overdose than other tricyclic antidepressants. We should be checking sitting and standing BP before we start these medications. Sometimes the adverse effects will happen almost instantaneously, but treatment effectiveness usually still takes 2 to 4 weeks. Patients may exhibit increased suicidal thoughts and behaviour. Consider prescribing small quantities to reduce the risk of overdose of these agents, and withdraw them slowly to avoid withdrawal effects. Thanks so much for listening. I hope you got a little bit out of it.